Hello and welcome to our EKG workshop. This is session 3. So first we look at this EKG strip and try to analyze it. As we mentioned in the last session, we need to follow a pattern, a table, in order to get used to reading EKG and don't miss major findings. So first we look at the heart rate and we try to determine the heart rate. We said we look at the distance between two R waves and then we compare that with the other RR intervals. If they are pretty much the same distance, then we can say the distance can be used for determining the heart rate. So 300 divided by the number of big boxes will give us the heart rate. Here we can see it is less than 3 boxes here, less than 3 big boxes here. That means we have tachycardia. So we said 3 big boxes, 300 divided by 3 is 100. Anything less than 3 boxes, that means we have a heart rate that is over 100, so we have tachyarrhythmia. In the case that we have more than 5 big boxes, so we said 5 big boxes would be 300 divided by 5, 60. So anything less than 60 will give us more than 5 big boxes between the two R waves, so we would have bradyarrhythmia. The next step is to determine the heart rhythm. So we said we look at every QRS complex, and if there is a P wave before every QRS complex, then we call it sinus rhythm. Then we look at the P wave and see if there are changes there. We mentioned P pulmonale and P mitrale. If we don't have those, we can look at the PR interval. We see if the PR interval is prolonged, and that is more than a big box. A PR interval is prolonged when it is more than a big box. A big box has 5 small boxes. Each small box is 0.04 seconds times 5. It is 0.20. So if the PR interval is larger than that, then it is prolonged and we have first degree heart block. Then we look at the Q wave. We look at the QRS complex. So if the QRS complex is prolonged, so that means it is more than 3 small boxes, then it is definitely prolonged. So each small box is 0.04 seconds. So a QRS complex that is more than 0.12, it is definitely prolonged. Then we look at the Q wave to see if the duration of Q wave is more than 1 small box, and here it is not. QRS complex also here is not prolonged. Then we look at the ST segment and T wave to see if there is any ST elevation, which is myocardial infarction, or ST depression, which is myocardial ischemia for the most part. Then we look at the T wave to see if there are changes in the T wave. If we see inverted T waves, negative T waves, then we can think of ischemia as well. But sometimes we have non-specific T wave changes, and those are not important. Then we look at the U wave. If there is U wave, it might be associated with hypokalemia. In some normal subjects, you can see U waves. So to wrap it up, here we can say that this is sinus tachycardia. The causes for sinus tachycardia include fever, exercise, hyperthyroidism. So usually in hospital setting, if we see sinus tachycardia, it is associated with fever. Even stress can do that. Thank you very much for your attention and see you next time.